button. This is the spinal process, okay? And the spinal lamina junction here. This is the left side, C4 lamina. This is a 4-5 interlaminar space. So we can, usually I like to have start drillings with the spinolaminar junctions. This is a C4 lamina, and the drilling over C4 lamina to expose yellow ligament. This is the outer cortical bone of C4 lamina. This is the outer cortical bone of C4 lamina. And the medullary bone of lamina bone, medullary bone of interlamina bone. And then this is the inner cortical bone. So drilling over outer cortical bone first, like this. This is here is the left side C4 lamina. I know you understand the anatomy. You know very well. Always the left side is the head, and right side is the leg. Right side is the caudal, and the left side is the cranial. And the 6 o'clock is the left side. And the 12 o'clock, you know very well, here is the midline. So here is the cerebrospinous area. Here is the cerebrospinous area. So with the preservation like this. So I would have to talk about how to go contralaterally. This is the medullary bone of cerebrospinous area. If you follow this medullary bone, you can go contralateral contralateral lamina. It is a very, very important talk. So my talk is if you this is the medullary bone of cerebrospinous area. So when you follow this line, you can go contralateral area. So drilling over medullary bone with the preservation of cortical bone. You can see here. When you follow this line, you can go contralateral lamina. So this is the medullary bone of contralateral area, and this is the inner cortical bone. So our drilling is medullary bone drilling first, like this, and then you can see there is no compression of a cord. We can remove the contralateral lamina bone like this. And then you can expose. If you follow this bone, this is the contralateral IAP. So you can drill like this. You can see here is the attachment of yellow ligament. So drilling over contralateral lamina like this, without any touch of cord, you can expose the contralateral yellow ligament. And when you go here, you can expose the contralateral medial wall of SAP. You can see here is the contralateral medial wall of SAP here. And if you wanna contralateral parameotomy, maybe here should become pedicle. So decompression of this area make your parameotomy very easily. And drilling over medullary bone more like this. Drilling over your medullary bone. Okay. So medullary bone drilling first. medullary bone drilling first, and then cortical bone drilling. It is steps. This is a cortical bone, okay? So medullary bone drilling first, and then try to cortical bone drilling like this.
During the surgery, if you any question, you can give me some of a letter for the question. We can ask to the Dr. Park. Anytime it's free.
This is a cortical bone. Maybe you can see there is no chance for the cord compression. Only outside in drilling. This is the inner cortical bone. And we can expose the attachable line of yellow ligament. This yellow ligament will protect our cord. This is drillings and try to expose the yellow ligament. Can you see here? This pink color means here is the cord. So you have to be careful. You have to be careful like this. This is the attachment. Usually this first epidural pad is midline, okay? So we are here. You can see here, and Y-shape separation of yellow ligament. We need a Y-shape separation of yellow ligament. Because our yellow ligament looks like butterfly. So first epidural pad here is a midline. It's a very, very important surgical landmark. And we can go both laterally. Because this yellow ligament has a Y-shape attachment. So lateral part is more cranially. So you can drill here. The most important thing is not to open the epidural space. So you can do like this. Here is the attachment line of yellow ligament. We are here, okay? And we need to the superficial bone drilling first, and secondary 라운드로 바꿔야 되겠다. 손이 지쳤어. Okay. So if you have any question, please let me know. This is the C4 lamina. So superficial bone drilling first, like this. Cortical bone, outer cortical bone drilling, and try to expose the attachment line of yellow ligament. I hope you we are here. This is the epidural space. So I mean, delayed epidural space is very, very meaningful. Delayed epidural space just before our epidural space is exposed. So we are here, and then I want to this is the yellow ligament. This is the attachment of yellow ligament. Here is the L4-5. But I want to make it. Try to remove this bone. Why? I want to remove this yellow ligament together. 4, 5, 5, 6 together. You can see one butterfly is here, and the other butterfly is here. You can see now you are watching two butterfly, and this is the upper margin of C5 lamina. I'm trying to drill here. 아래부터 내주세요. Drilling over upper margin of C5 lamina here. because I want to remove with together, not separate. Usually you can decompress this one piece and another butterfly here, but I want two butterfly together coagulation. So you have to drill this bone. When you drill this bone, you can take out together. You can see here. I wanna drill this bone. This is the upper part of, yeah, you can see movement over here. Upper part of C5 lamina. Finally, everything is movable. Everything is movable. You can see here. Okay. So my talk is we can expose, we can remove this hook. So finally, I complete the drilling stage. But if you want foraminotomy, we can perform parameotomy here. Parameotomy is a removal of SAP. That is a parameotomy. But before removal of this yellow ligament, you have to perform parameotomy. Because just like this, your epidural space is exposed. This water pressure is transported to the cord. So water pressure can compress the cord. So my talk is please expose your epidural space lately. Actually, we can very easily we can perform the parameotomy for audience because I have my operation already completed, but I remained 30 minutes. I want to show you how to get parameotomy here. Okay. So 들려줘봐요. So ULBD 2-level ULBD is complete, nearly only when I remove this one, my surgery is completed. But today I want to show you how to get parameotomy together. How to get this is IAP. So when you drill here, very easily. When you drill here, you can expose SAP. Parameotomy means removal of SAP. So when you drill IAP, you can expose the SAP. So this is IAP. Because SAP is one body of distal lamina. So when you follow here, you can expose. This is IAP. You can expose. You can expose the SAP here. So everybody have some question. What is a spinal canal? Where is the facet joint? If you find the interfacetal cartilage, when you find the interfacetal cartilage, there is a facet joint. So this is the IAP. With the drilling of IAP, you can expose the interfacetal cartilage. Can you see this one? This is the interfacetal white color. This one. This is the interfacetal cartilage. It means our facet joint is start from here. This is the interfacetal cartilage. So you can expose. Yeah, this is the interfacetal cartilage. So lateral mass is starting from this point. So you can, after drilling over here, and expose. When you drill this one, you can expose the IAP, SAP. This is the IAP. And then you can expose SAP. So, exposure of tip of SAP is very, very important. Exposure of tip of SAP. So, 드릴을 바꿔야 되겠다. 예. 네, 카메라 봐, 카메라. Okay. Sorry, my camera has some problem, so give me 1 minute. I will change my camera. Okay, 카메라 바꿔주라. 손 주시죠. Hello, everyone. If you have any question, please let me know. So, because I already performed the drilling stage for a 2-level decompression, I'm trying to show you how to perform parameotomy. So here is the L45 foramen. So now I am drilling the IAP. So 그랬죠 보세요. Let me explain again surgical anatomy. So I already told you here is the left side. I am standing because I stand the left side. You can see here, this is the upper margin of C5 lamina. And you are watching here, this is the tip of SAP. So 100%, our root is like this. When you remove tip of SAP, you can expose C5 root. So I will show you how to expose C5 root. So another one is everybody knows where is the spinal canal. Everybody want to know where is the spinal canal and where is facet joint. You can see here, this is a facet joint cartilage. So this cartilage means this is IAP and this is SAP. So when you remove this one, you can see something. And also we can, when you go here, we can palpate some upper pedicle and distal pedicle. So we are here. So I'm trying to expose the tip of SAP. This is the tip of SAP. And I have to drill here more. 라운드를 줘보세요. 오케이. 어차피 이게 잘라야 되는데. posterior cervical parameotomy means posterior SAP removal. 아래 붙으세요. So exposure of SAP and the removal of SAP cutting. You can see here, this is the tip of inferior pole of IAP, okay? And I believe my talk is a coagulation. Yeah, this is the tip of SAP. So,
At this moment, which level? Which level?
4-5. Here is a 4-5, yeah.
Left, 4-5 left.
4-5 left.
So
So
5.
this is a SAP over C5. So if you expose C5 pedicle, yeah, this is the upper end of C5 lamina. So we have to finding pedicle is very, very important for posterior cervical decompression surgery. So this is a tip over SAP, and I'm trying to do this. If you can see pink color here. Pink color means spiral canal. Okay, so make it here. This is the SAP. And you are near to the pedicle of C5. 드릴버를 새 거로 바꿔줄래? 라운드. I believe everybody look this one. This pink color means the code level. And this is a C5 pedicle. This is a C5 pedicle. Can you see here? This is a C5 pedicle. You can see medial wall. Yeah, this one. This one is pedicle. And you can see here. Yeah, this is the tip of SAP. Can you see here? Yeah, this is interpolated. Yeah, this is the tip of SAP. When you remove this tip of SAP, that is a parameotomy. So I hope you understand that this is a C5 pedicle, and this is a medial wall of pedicle. Can you see here? This is a medial wall of pedicle, and this is the upper margin of pedicle. So you can see here C5 root. I mean, you can see here, this is medial wall of pedicle is here, okay? This is root. So you can find the pedicle. Yeah, everybody, now everybody can see this is C5 root. This is a C5 root. And I believe this is a medial wall punch, 1mm punch. So after parameotomy, I will show you this pedicle again. I believe this is a pedicle. I'm not sure. pedicle 아닌가 보다. Okay, but okay, you can see the root. Can you see the root here? And I want to show you pedicle is the C5 pedicle is here. Sorry. 제가 actually C5 pedicle should be here.
So everyone has to know the endoscopic anatomy.
Yeah. This is a C5 pedicle.
Several times.
40.
So pedicle has a, we can see medullary bone.
Hello, Chairman.
Yes.
May I explain surgical anatomy again?
Yes.
Yes, this is a C5 pedicle. Can you see here?
Yes,
And
yes.
this is the medial wall of pedicle. Here is the cord level. This is a coagulation. This is a C5 root. This is a foraminotomy. This is a C5 root. Okay. When you remove this yellow ligament, we can see everything. Now I wanna show you how to remove a yellow ligament without touch of cord. 물 안 들어온 것 같지? Yeah, I already have a drill here. Okay, so I'm exposing epidural space. You can see the pulsation of cords. So without any touch of cord, we can separate the attachment of yellow ligament, and we can move the caudally like this. Yeah. This is a contralateral area. Here is the left side. So without any insertion of cannulation punch onto the cord, only lift a mast. Yeah, this is a root. Now, lately, I want to show you about C5 root. And only lift up the yellow ligament. Lift up the yellow ligament. We are here. And we can also separate. More distance. Be careful. We have to keep this flat. And I want to move caudally. So we are here. Wait a minute. Okay. Going to the caudal area. Okay. Here. Here is 피가 좀 많이 나는데 피자컬. I don't know. Epidural vein 90도 적어라. Bleeding from the epidural vein plexus. So I wanna control this one coagulation. 파워 낮춰라. coagulation. This is a C5 pedicle and C5 root is here. And I'm moving to the caudally coagulation. Okay, I find here coagulation. Okay. coagulation. 여기 있는 것 같은데. coagulation. 여기 그거 좀 내놔. 타코실 안 해줄래? 타코실. coagulation. Maybe our bleeding is here from the foramen here. 1mm punch 볼래? You can see this, you know, I believe you know very well. This is a C5 root. So I'm doing C5 foraminotomy here. C5 foraminotomy here. We are doing here. And when you remove this epidural plexus, you can see very clearly the C5 root. 풀어보자 볼래? Okay. This is 이거 피가 나서 그만해야 될 것 같은데. 타코실 빨리 좀 줘. 오케이. So 볼팁 줘보고. 볼팁. 줄 짧고 줄 짧아. So we have wonderful RF. We have a wonderful RF probe for epidural bleeding control coagulation. This is very, very useful for epidural bleeding. I hope you know this is a C5 root coagulation. And I'm going to 바꾸시 나오는데 하루 종일 걸리냐? 저거 물려줘.
So he mentioned almost 20 times he the preserving the ligament flavum almost the end of surgery, just before the dural exposure, maintain ligament flavum to prevent the dural compression by fluid.
Okay, so I wanna continue the removal of yellow ligament. So this is a tacosil for sometimes it's useful the bleeding control here. RF TV touch 조금 더 했으면 좋겠다. Okay, let's move to another place. So we know very well. This is a yellow ligament. 큐렛 줘보세요. 큐렛. And try to remove, separate the yellow ligament. This is a contralateral medial wall of SAP. Separation of yellow ligament from this is a contralateral SAP. You can see the contralateral SAP here. And the separation of your yellow ligament like this. Yeah, this is the upper margin of distal lamina. This is we are here. Separation of our yellow ligament from the attachment of lamina. We are here. And I hope you watch the usefulness of endoscopic retract. With the endoscopic retract, we are here, separation of yellow ligament here. This is a distal attachment of yellow ligament. So separation. I hope you can see I'm not touching. No touching cord. Without any touch of cord, I am separating the yellow ligament from the lamina. This is a C6 lamina, upper margin of C6 lamina. So we are here. and the lateral margin over here. We are here. So we can go, 비추다 줘보세요. So I hope I can take out. You can see the pulsation of cord here. Yeah, you can see the yellow ligament here. You can see the yellow ligament here. So we are here. 그러고 다시 줘보세요. Upper margin of C6 lamina is here. So we can separate this one. We can separate this one without any touch of cord. So separation over. We need more drilling. Okay. So this is a cord. So without any insertion of punch, only we can separate this yellow ligament, and then finally we can take out this yellow ligament. pituitary 줘보세요. Remove pituitary. So because our skin incision is very small, so sometimes taking out the yellow ligament is not easy, but I'm trying to remove it with okay, I hope I can take out the yellow ligament with one piece. Because our skin incision is too small. Sorry, it is separated. But we can try again. Remain the yellow ligament here. Okay. We need more big skin incision. Sorry. 야, 이빨 있는 거 맞냐, 이거? 이빨 있는 거 맞아? 오케이. Okay. Try to remove. So anyway, I want to show you the well decompressed cord here. And you can see the pulsation of a cord also. And this I will also show you the root of C5 root. So C5 root, looking for a C5 root. Maybe this one. Here. Here is a C5 root with the taco seals. So our goal, the more difficult one is the removal of yellow ligament pituitary. So I'm trying to remove this yellow ligament. 다시 큰 거 줘봐야겠다. 밀어넣고 다시 해야 되겠다. Okay, so removal of yellow ligament with small skin incisions. So repositioning of yellow ligament with the previous site. We are here. This one, pituitary 다시 보시고. I hope we can. Okay. Try to hold this yellow ligament. And take it out. Okay. So finally, I can take out whole yellow ligament. And I wanna show you C5 pedicle also here. This is here. This is a taco seal for breathing control. Yeah, you can see the C5 root here. Focus 맞춰. So this is a immediate punch. Immediate punch. This is the SAP. This is the SAP for When you remove this part, we can complete our parameotomy. And if you want to do this root more clearly, we can probably hook. we can remove epidural vein nerve sheath. Sometimes we call here epidural flex of, okay. So when we can remove this sheath. When you remove this sheath, we can see root more clearly. We can see more clearly, but we don't need to remove this sheath. This is a C5 root, and this is a cord. And you can see the contralateral margin of cord very well. And also you can see the contralateral foramen, contralateral root also. contralateral root also 더블 주세요. This is a contralateral root. And if you want a contralateral parameotomy, you have to remove this SAP. And maybe contralateral pedicle is here. So when you remove this bone, you can make contralateral parameotomy. 더블 주세요. Make contralateral parameotomy. You are here. 커브 Okay. Be careful. Okay. I want to show you. Yeah, you root. I hope you can recognize this root. This one. Contralateral root is here. And okay, this is a contralateral root. And here, contralateral side. Yeah. So I would, if you, chairman,
Yes, we can
can you
hear.
hear me? Do you have any question for me?
Question.
Now I want to complete my surgery.
Yes, yes.
So
Wonderful.
decompression, parameotomy, everything. Okay.
Okay.
Yes.